Last week, the Canadian Medical Association issued an apology to the First Nation, Inuit, and Métis peoples, saying it is deeply ashamed and deeply sorry for the past and present harms that the medical profession has caused to their community. The top misdeeds include Indian hospitals, where the CMA says Indigenous patients receive substandard care. Métis elder Jimmy DeRocher says the apology by the Canadian Medical Association for past harms done to Indigenous peoples is an important truth that can begin to facilitate healing and reconciliation. Dr. Reimer, president of the Canadian Medical Association, joins us now to discuss the apology. Dr. Reimer, thank you for joining us.
Thank you so much for having me.
Now, why did it take a push from Indigenous doctors for this apology to be issued?
I think it's a fair criticism to say that this apology came too late. The organization has existed for over 150 years, and we know that harms have been occurring to Indigenous peoples throughout that time. And so whenever the apology came, it couldn't be soon enough. And so we're just thankful that with support from Indigenous elders, knowledge keepers, Indigenous physicians, community members, that we got to where we are today and can start to move forward in a good way.
Now, the CMA announced it would issue a reconciliation plan that outlines how the association will advance health and well-being for Indigenous peoples. Why do you think a plan like this needs to be created and the organization can't just treat Indigenous people without there being a blueprint?
I think it's really key to have an action plan. We've all received apologies where someone's behavior doesn't change. And when that happens, the apology rings hollow. In fact, it can cause harm because now you know that that individual knows what they're doing and still continues to cause that harm. And so it was critical that we move forward with an action plan that everyone could see. We needed to be transparent and demonstrate that we were serious about changing behavior, about changing the system so that these harms stop occurring.
Now, the chief medical officer of the First Nations of Quebec said the presence of discrimination is still there and we have to deal with this problem. Now, how does the CMA intend to hold themselves accountable if the reconciliation plan is not followed?
Yeah, and there's no question that these harms continue to occur. One of the things, I work at Women's Hospital in Winnipeg, and we continue to see child apprehensions happening disproportionately to Indigenous families. And so in our action plan, one of the things that we've committed to doing is opening up our code of ethics, because we want to make sure that racism, discrimination are fundamental parts of that code of ethics. And that is something that we're going to move forward with. We also have our Indigenous guiding circle, and we're going to continue to work with them and follow their lead. And that is something that we're committed to continuing with. We know that we need to do this path in partnership, and we know we need to respond to the guidance of Indigenous experts. And so that is something that we hope that all of our members, all physicians, and all patients in Canada hold us accountable for.
In 2020, an Indigenous mother of 7 died in the hospital after recording the hospital staff making racist comments towards her. Now, this is only one incident of countless mistreatments. Will there be any disciplinary action towards medical staff that performed sterilizations without consent or withheld treatment or made racist comments?
The Canadian Medical Association doesn't have any authority to issue discipline for any of our members. That's something that the colleges at the provincial and territorial levels would have to do. But what we are committed to doing is to calling out when we see action that is causing harm to Indigenous peoples. So this is something we're deeply committed to, and we want to help to train and support all physicians, medical learners across the country in their own path of reconciliation.
Now, I'm curious, the Truth and Reconciliation Commission started in 2007. You did briefly touch on this with my first question, but why did an apology take so long?
Well, the Truth and Reconciliation Commission was absolutely one of those fundamental turning points that led us to look down the path to determine what we needed to do. And then we spent years looking at that, looking internally to try to assess. And it was really our Indigenous guiding circle, when that was put together, they were the ones who told us that an apology was a necessary next step. And so we're so thankful to all of the experts who participated in that guiding circle. Certainly when we had our first Indigenous president, Alika Lafontaine, which was only a couple of years ago, that was another helpful push in this direction. But regardless, this is something that has been needed for many years. And so the years that it took to prepare were important to make sure that we had been transparent, that we looked at what we actually could demonstrate that we had caused harm in, and that we listened to voices so that we added where our records maybe didn't show harm, but that the community members were telling us that indeed we had participated in harm. And all of that work led to the apology that we saw last week.
Dr. Reimer, thank you so much for your time today.
Thank you so much for this important topic.